Hi, Tony DeWitt here, Missouri appellate attorney and a guy who likes to make the law make sense on YouTube. Today I am traveling down to Gulf Shores State Park in Alabama, and I'm going to be talking tomorrow to the Alabama Society for Respiratory Care. So I thought I would clue you in on some of the things I'll be talking about. So let's talk about this down at the beach. Well, I will be doing my presentation tomorrow on Wednesday at about 9 o'clock, and I will be talking to a large group of professional respiratory therapists that are gathered down at the state park. The really nice thing about respiratory therapists is that they are a fun bunch of people to deal with and a great bunch of people to have fun with. Now, I won't be able to have fun with them. I'll have to go right back once I'm done because I have other responsibilities. But I have always enjoyed talking to them because they are probably the most misunderstood and underappreciated group of professionals in healthcare. Let's talk a little bit about what a respiratory therapist does, because many of you probably don't know. It started out in the 1960s basically as inhalation therapists. And somebody decided somewhere along the line that people did more than just inhale, they also exhaled. And so the name got changed to respiratory therapists. But respiratory therapists were initially just people who ran around and gave treatments. Then, as it became more and more common for people to require mechanical ventilation, they became responsible for managing the mechanical ventilators in a hospital. And over the last, I would guess the last 30 years, the scope and role of respiratory therapists in hospitals has really greatly expanded. When I practiced as a therapist, and I began in 1981, and I started work at a hospital in Kirksville, Missouri, and then I went to school and became a registered respiratory therapist, which at the time was a 2-year program. Now, many of the 2-year programs are going by the wayside and becoming 4-year programs because there is so much more to learn now that respiratory therapists are doing additional things. And indeed, there are a number of very highly qualified master's prepared and even doctorate prepared respiratory therapists out there doing the work in the field. Many of them are researchers, many of them are people who are involved in resuscitation teams and that sort of thing. So what does a respiratory therapist do? Well, at the bedside, he will probably do an assessment of a patient who requires respiratory therapy. It depends a lot on the quality of the medical staff in the institution where the respiratory therapist practices. If the hospital is a university hospital, in most cases, the scope of practice for the therapist will be pretty good. They will have the responsibility to assess patients and give therapy based on a protocol. Now, a protocol is just an extra long physician's order that's written to have some branching logic in it that says if the patient does this, you do that. If the patient doesn't respond to this modality, you can change them over to another modality. And in that regard, they follow sort of a clinical pathway and they work hard at getting patients breathing better. That's especially helpful after surgery. If you have abdominal surgery, the last thing you want to do is take a deep breath. And for many, many years, that was the reason why patients passed away after surgery, because they would develop pneumonia and the pneumonia would progress to the point where they could no longer breathe. But respiratory therapists now the field of respiratory care is now much different. In the intensive care unit, a lot of times respiratory therapists are managing mechanical ventilators, which are truly life support equipment, also based on protocols. Respiratory therapists draw blood gases. They insert a needle into the radial or brachial artery and they withdraw blood and analyze it to tell them the status of acid base and also to find out how well the lungs are exchanging oxygen and carbon dioxide. Those tests help guide them in the treatment of patients who are on a ventilator or who might need to go on a ventilator. In addition to that, respiratory therapists are usually part of the code team, meaning that because they are usually more of them in the hospital at any one time than doctors, that they are often the first at the head of the bed, and because oxygen is necessary to ensure survival, they are the individuals who intubate, who put a tube down into the lungs to make sure that ventilation can be accomplished successfully. As you can see, it's quite a unique healthcare field, and the people who do it are unique. During the pandemic, they got coughed on, sneezed on, hacked on, bled on, and they went to work every day and did their job. So in my view, they're a bunch of heroes. And I don't think very many people understand what respiratory therapists do. I know I have a few who are subscribers here, and of course they understand it better than any of us. But it is, as Joe Friday once said about being a police officer, it's a glamorous, thankless job that's got to be done. There is absolutely no glamour in having mucus coughed all over you, but it happens on a daily basis to many respiratory therapists across the country. So those are the people I'm going down to talk to. And of course, they have concerns about being sued. So my job is to talk to them about how not to get sued. And in doing that, I explain the law of negligence and the law of medical negligence in particular. Medical negligence, sometimes referred to as medical malpractice, varies from state to state, and it generally requires that you show that there is a duty to the patient. And of course, if a patient is in the hospital, there is a duty to that patient. They are there for healthcare services. That there is a breach of that duty, and in the case of respiratory care, that means a deviation from the standard of care. Well, what is the standard of care? The standard of care is what a reasonably prudent practitioner, faced with the same circumstance that faces this therapist, would do in that situation. And of course, as a result, it has to be proved by expert witness testimony. And of course, that can come from a doctor or from a respiratory therapist. The goal for most respiratory therapists is not to get sued. But almost everybody makes mistakes. It happens on a daily basis. In fact, one of the things that I often said to my therapists was that the reason they put erasers on pencils is because everybody makes mistakes. And I believe that to be true. I think it is very important for the general public to understand also that respiratory therapists are usually sort of a short commodity. They're in short supply in many hospitals. And as a result, from the time they get on their shift at 7 a.m. until the time they go home at 7 p.m., they are running nonstop. They are going from place to place taking care of patients. It can be a very physically demanding job as well as a mentally demanding job. And respiratory therapists don't have the right to make their own schedules. They don't get to choose the patients that they care for. They get to care for the patients they are told to care for, and they don't have any input into the number of people who are assigned to work on a particular shift. That's the boss's job, and the boss determines how many people are going to work on a shift. Well, as you can imagine, during the pandemic, it became very difficult to staff some of these hospitals with respiratory therapists simply because many of them were getting sick and having to stay home. One of the concerns that many respiratory therapists have is, what if I have too much work to do and not enough time to get to it? And if you've been in a hospital recently, you know that the entire mantra of hospitals these days is treat them and street them. They want to get you in and get you out as fast as possible. And of course, therapists have a role to play in that. They try to get patients off the mechanical ventilator as early as possible so that they can go home as soon as possible. But they don't get to staff their offices the way any other private practitioner might. They have to depend on the hospital to supply enough respiratory therapists to do the job. And when they don't, they wind up having to do triage. So triage is medical decision making that's based on medical need. People who are the most sick and have a chance to survive get seen first. People who are less sick tend to be seen a little bit later. And unfortunately, triage is one of those things that is not a perfect science, and it is possible to make mistakes during triage. In that situation, however, it isn't the individual therapist usually that should be held liable. It's usually the hospital, because the hospital is in charge of staffing its operation. And if it doesn't have enough staff, it should turn away patients. Unfortunately, not many of them still do that. Well, that's what I have for you today. I'm going down there on Tuesday. I will be there on Wednesday, and I will try to get something set to go in the interim. But if I don't have a video out there on Wednesday, now you know why. If you have an opportunity, do something nice for somebody today. Have a great day, and I will catch you down here at the beach next time.
If you like this video, here are a few others you might try, and don't forget to subscribe. Have a terrific day, guys.